Okay, is anybody out there? Okay, thank you, Olga. I apologize for that very embarrassing technical breakdown. I don't know what happened. I think too many people use this platform at the same time. In any event, let's move on. Let's talk about the circulatory system. Circulatory system, otherwise known as the cardiovascular system. Function is to take the oxygen that's brought into the body, as well as other stuff as well, and distribute it throughout all the major organs and cells of the body, from the brain to the stomach to the muscles to the kidneys to the toes. And it does that by the function of three major components: the blood, the heart, and the blood vessels. So if anybody asks you what the main components of the circulatory system are, that's what you would answer. And in itself, it's a very complex structure, but it's also pretty fascinating too. It's because when we talk about heart disease and problems with cardiac arrest and CPR, it's good to know a little bit about how the cardiovascular system works. We're going to talk a little bit about heart attacks and how that works. All right, let me select the slide to navigate. This system is slow as, well, I don't want to say the word, but you know what? I think next time I'm just going to get a chalkboard and do the lecture the old-fashioned way. All right, here we go. Bear with me. Okay, can everybody hear me? Okay, I apologize for that embarrassment. Let me just see if I can get this working. Okay, with that, I'm giving everybody an extra 10 points on the quiz you just took as a makeup for this inconvenience. So I'm not joking. 10 points. So anyway, let's get back to talking about the heart. All right, the heart is an amazing structure. It's composed mostly of muscle, but it's composed of the other types of tissue as well, epithelial and connective. And its job is to physically move blood throughout your body every single minute of every single day of your entire life. And it's located right in the center of the chest in the space called the mediastinum. A lot of people mistakenly think it's on the left side of the chest, but it's not really the case. Usually when you feel the left side of your chest thumping, it's because you're feeling what's called the apex of the heart, where you really have the strongest contraction occurring. As you can see, it has 4 chambers. The right side of the heart brings deoxygenated blood from the whole body that's been worn away. It's received through a chamber called the atrium, and then it flows into the bottom chamber called the ventricle. Then the heart squeezes and it pushes the blood through the pulmonary artery to the left and right lungs, where it drops off waste product carbon dioxide, picks up oxygen, returns to the heart by something called the pulmonary vein, and lands in the left atrium. So the left atrium is receiving nice, brand new oxygenated blood ready to go. From the left atrium, the blood goes into the left ventricle. The left ventricle squeezes and it pumps blood throughout this major pipeline called the aorta. And the aorta splits up into smaller arteries delivering oxygenated blood to each and every part of the body. Now, the interesting thing about the heart, though, is that even though blood is flowing through it in all the 4 chambers, the heart itself does not really get its oxygen from the blood that's circulating through it. Instead, the heart gets its blood from these little arteries that wrap around it called the coronary arteries. And therein lies the problem with heart attacks and cardiac arrests, as we'll discuss later on. Then you have your different types of blood vessels. You have your arteries, which carry blood away from the heart, and as such, they're usually under very high pressure. So damage to an artery can be pretty life-threatening. It can bleed out in a matter of moments. Arteries split up, become smaller arteries and smaller arteries until they ultimately become so thin, they become these tiniest little blood vessels called capillaries. And at the capillary level, only one blood can squeeze in through a time. And that's where oxygen is exchanged and carbon dioxide is exchanged and some nutrients are exchanged between the blood and the cell. I mean, it's just billions and billions of capillaries. And then as those capillaries converge, they get bigger and bigger and they turn into what's called veins. And all veins ultimately converge and return blood back to the heart. You can actually feel arteries close to the surface of your body in a location called a pulse. A pulse is anywhere an artery comes close to the surface of the body, and you could take 2 fingers and feel it. And every time you feel a pulse beat, that's an example of your heart contracting. Carotid pulse is found in your neck. Femoral is found where your leg sticks out of your body. Radial is the most common. It's on the thumb side of the wrist. Brachial is under the bicep muscle. Posterior tibial artery, that's behind your ankle bone. Dorsalis pedis artery is between your toes. And don't worry, don't try to memorize all that. The only artery, the only pulse I would probably want you to memorize is the carotid one, because that's really the most important one we're going to talk about when we talk about CPR. And just to get an idea of what the cardiovascular system is meant to do, it's meant to maintain a certain amount of blood pressure. Blood pressure is the measure of the pressure exerted by the blood on the walls of the flexible arteries. And it's usually measured in 2 numbers. You maybe had your blood pressure taken at the doctor's office, 120/80. The 120 is the pressure that's exerted on the wall of the artery as the heart is squeezing and contracting. That's called your systolic blood pressure. Then that bottom number, 80, is the pressure that's released on the artery as the heart is relaxing. That's called the diastolic. There is a little bit of inaccurate thinking that the bottom number is the one that's important, the top number is not so important. That's not the case. Both numbers are important, and the higher your blood pressure is over a longer period of time, the more chronic long-term damage occurs to your body. Kidney failure, heart failure, stroke, just to name a few things over the course of time. Then components of your blood, you have your plasma, which is the liquid portion of the blood, which makes up the body of your blood. You have red blood cells, which are responsible for carrying oxygen in your body. You have white blood cells, which are responsible for fighting off infection. And then you have platelets, which are responsible for clotting the blood. Seeing any defect in any of the blood vessels that's passing by, it'll plug it up and it'll call for more platelets and kind of create a patchwork to prevent any further damage. There is a condition I'd like you to be a little bit familiar with called hypoperfusion or shock. And we'll address this a little bit more in a later class. But hypoperfusion, well, to know what hypoperfusion is, you really got to know what perfusion is. And perfusion is the adequate delivery of oxygen and nutrients to each and every cell. And for that to occur, you have to have a properly functioning heart, you have to have intact blood vessels, and you have to have an adequate amount of blood. If any one of those fail, then you can go into a state called hypoperfusion, most commonly known as shock. Inadequate circulation of blood through an organ system. I'm not going to go into I don't want you to bother memorizing the signs and symptoms, because that's something we'll talk about later on after the first exam. But one of the more serious conditions that we're going to talk about pertaining to the cardiovascular system is what's called an acute coronary syndrome, or what the layperson would call a heart attack. Heart disease is still the #1 cause of death in adults in the United States. And the reason why most of it occurs is because in one of those arteries that feed the heart that I was speaking about becomes plugged up with fatty deposits on the wall. And that deposit tends to weaken the side of the wall. And as over time, a little piece of that inner wall might rip off. And then what's going to happen with those platelets? They're going to see that defect. They're going to pile up, and they're going to cause a blood clot. If that blood clot completely blocks up that coronary artery, whatever it feeds downstream is not going to get oxygen. So whatever part of the heart that artery is feeding is going to start breaking down and ultimately dying. And the goal for first aid is to recognize the signs and symptoms of a heart attack or a possible heart attack, what immediate treatment we can do in the meantime, and how to get that person the proper help. We also want to talk about who's more at risk for heart disease as well. Okay, you will have to memorize this whole chart for the next exam, because it's very important to know, especially if you're going into any other class as well, even if it's a liberal arts class. It's not that hard. Just start from one point and just memorize each point. No, I'm only kidding. The nervous system is responsible for coordinating the day-to-day activity of the human body. Just anything from external motion to internal metabolism is coordinated by the nervous system. Now, you can break down the components of the nervous system anatomically and physiologically. If you're going to break it down anatomically, the two main components of the nervous system, and the most important really, are the central nervous system, which composes the brain and the spinal cord. The brain you can consider your central processing unit, responsible for everything. And the spinal cord, which is the main conduit, the main highway that delivers messages and information to the rest of the body. Then you have the peripheral nervous system, which kind of branches off the spinal cord, and some nerves that even branch directly off the brain themselves. And then they travel down all parts of the body. They connect to muscles, they connect to glands, they connect to other nerves, provide a whole network of exchange of information. And the real building block of the nervous system is something called a nerve cell, or a neuron, which has three major components. You have the cell body, which is the main hub of the cell, which relays and processes all the information. you have these things called dendrites, which receive information usually from other nerves or other organs as well. And then you have this long transmitting wire called the axon. And that axon releases chemicals to stimulate one of three things: a nerve, a muscle, or a gland. Yes, Delfino.
Just quick question for the exam and for the homework. Do you want us to actually know certain parts that make up like the nerve, the respiratory system, circulatory system, or is it just
I wouldn't hold you to the parts of a neuron. It's just more for like information purposes. I would
okay?
like you to know the major parts of the respiratory system, like what are the lungs, what is the diaphragm, what is the bronchial, the major components of the cardiovascular system, the blood vessels, the heart. Would really get 2 point specific. You'll have plenty of time to worry about that when you take other classes.
All right, copy. Thank you.
So physiologically, the nervous system can be divided into two components: the somatic nervous system, which is not shown here, which is involved more with voluntary muscular movements, and then the autonomic nervous system, which, if you listen to the word autonomic, it kind of sounds like the word automatic, doesn't it? The automatic or the autonomic nervous system controls the involuntary aspects of the body. You have the sympathetic nervous system and the parasympathetic nervous system. They antagonize each other. They work in opposite. The sympathetic nervous system is your fight or flight response system. It's there to gear you up in times of danger or perceived danger. It acts up when a wild bear is chasing you in the woods, or an 8 foot tall, 300-pound hockey mask wearing machete wielding maniacs in the forest. But it also kicks in if you're experiencing a heart attack or low blood sugar from a diabetic emergency. It kicks in with internal dangers just as well as external dangers. Heart racing, sweating, rapid breathing, more awareness. But you can't live yourself in that condition all the time. You have to have some type of braking mechanism, and that's where the parasympathetic nervous system kicks in, otherwise known as the feed or breathe or rest and digest system. It just does the opposite. Decreases the heart rate, decreases the blood pressure, promotes digestion. So you usually have both systems constantly balancing each other out during normal daily activity. It's only when extremes of environment kick in where one takes over more than the other. And so some of the more common neurologic disorders to think about are stroke, which is an interruption of the supply of oxygen to the brain; seizure, which is electrical abnormality of the brain; other things like dementia, Parkinson's, paralysis, ALS. We may be able to touch upon a little bit. Those are more chronic illnesses, but stuff that's maybe interesting to read up on. Now, the skeletal system has a lot of functions. Its major function is to provide structure and support to the body. If you just had muscles and nothing else, you'd have nothing for those muscles to attach to and move. You'd just be like a roly blob, just kind of sloshing from one place to another. The skeleton has 206 bones in the adult. Children actually have more bones than adults. Children have something over 300. Like, how can that be? Well, when children grow and grow, parts of their skeleton actually fuse together. So two bones will become one bone. And so once they completely mature, the adult skeleton has less bones, stronger bones. As you can see here, bones are made up of living cells surrounded by hard deposits of calcium. That's an important thing to remember. Bones are metabolizing living tissue. They're not just benign structure, hard sticks. So they bleed, they have nerves, they regenerate. They build up cells, they break down cells. I believe my anatomy professor back in college said that you turn over a new skeleton about once every 7 years. That's kind of interesting. Especially around Halloween time. You have different types of bones. You have long bones, such as in the bones of the arms, the humerus, the radius, ulna. You have flat bones, like in the ribs or the pelvic wings. You have irregular bones, which you would find in the backbone, such as the vertebrae. You have short, you can't really see it here, but you have short bones, which you would find in the wrist. You actually have 8 bones shaped like cubes in the wrist alone. The most important set of bones is the skull, which houses and protects the brain. provides structure for the head. Bones do more than provide structure. They protect organs. They allow for movement, like I said. They're also important in producing blood. In long bones, in the inner cavity, have something called marrow, which helps produce red blood cells. They're also important for regulating the amount of calcium in your bloodstream. You might have learned in high school and grade school that calcium is important for strong bones and teeth, but calcium is also important for muscle contraction, nerve conduction, a lot of metabolic activities. And if your calcium level in the blood goes too low, that can throw you off whack. So one of the ways the body compensates for that is taking little bits of calcium off the skeleton of your bones if the blood calcium level becomes too low. We'll hit up on this more detail when we talk about neurologic emergencies, but one of the most important set of bone structures in your body is called the spinal column. The spinal column, otherwise you might call your backbone. Your backbone. So the spinal column is a set of about 33 short, irregularly shaped bones called the vertebrae. And these vertebrae form this little S formation here that allows a greater distribution of the weight of the head over an axial load. If this vertebrae, if this spinal column were straight up, it would get worn away very quickly from the weight of the head. Now, this is something I would like you to know. The backbone is divided into 5 major sections. The cervical, which makes up the neck, the first 7 vertebrae of the body. The thoracic, which makes up the next 12, are the upper torso, the upper back. The lumbar, which makes up the lower back. Then you have the sacral vertebrae over here, which really makes up the back part of the pelvis. And the coccyx, it's this little tail end right here, which nobody really knows its function, but it's there. The thing that's different about the sacral and coccygeal vertebrae is that they're fused together. They don't really allow any movement. The 2 areas of the spinal column that are most easily damaged are the cervical and the lumbar. And you can even test it out on yourself. Why would they be the most easily damaged? Well, they're the most easily movable. So with more movement comes less stability and more inclination towards injury. You can roll your head around all different directions. You can also do that with your lower level. The thoracic vertebrae are surrounded by thick, bulky muscles of the back and chest, so they don't have as much movement and flexibility as the cervical and lumbar. That's why it's not as common for upper back injuries to occur as lower back injuries. Oh, there goes the ice cream truck, and there goes my kid screaming. Okay. Some of the more common skeletal problems that we'll talk about are fractures or breaks in bones, dislocations, where a bone comes out of place, and some conditions like osteoporosis and cancer, which can cause bone problems as well. So we've talked about muscle tissue, but muscle tissue coming together creates the muscular system. Muscle systems are basically come in 3 different types. Voluntary muscles are under the control of the person for making deliberate actions, and they're mostly used for external movement, locomotion, movement of the organism, the person, from one place to the other. Then there's smooth muscle, which is found mostly in your hollow organs, like your esophagus, your bloodstream, your blood vessels. And the purpose of smooth muscle is to kind of transport material within your body. And it's usually under the control of the nervous system just as well as skeletal muscle is. Then you have a 3rd type of muscle called cardiac muscle, which is only found in the heart. Now, the interesting thing about cardiac muscle is that although it's influenced by the nervous system, you could theoretically, and I say theoretically, detach the heart from its nerves, and if it was still fed blood and oxygen, it would still continue to contract and beat for indefinite amount of time without any nervous stimulation. It can generate its own contraction. That's something that's called automaticity. So it's something like right out of a horror film where the killer plunges his fist through somebody's chest, pulls out the heart, holds it to the camera, and the heart's still beating, going boom, 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 boom. That can actually happen, but don't try that at home. And some of the skeletal muscle problems we'll talk about are strains, which are problems with muscles and tendons, sprains, which are problems with ligaments commonly in the joints, and spasms, which can be very painful. All right, so the skin is not really an organ system. The organ system itself is called the integumentary system, if you want to get really scientific. And you see two layers right here listed. The epidermis, I'm sure as kids you always said, haha, your epidermis is showing, and then your dermis. The epidermis is a couple of layers of thick, pretty much dead cells that provide a barrier and are constantly turning over. The dermis is where you find all the really important organelles of the integumentary system: the nerves, the blood vessels, the glands, sweat glands, oil glands. And then below the dermis, you could probably call a third layer of the skin called the hypodermis, also called the subcutaneous layer. It's this little layer of fat that helps cushion the dermis from its underlying structure. Provides insulation and attachment to other muscles and bones as well. Some of the functions of the integumentary system, well, for one, giving your appearance, for two, kind of packing in and sealing in all your contents. It's also important in temperature regulation, the release of perspiration when you're overheated. It's actually important for vitamin D metabolism. People who are never ever exposed to the sun tend to be deficient in vitamin D, which is important for calcium metabolism, to just name a couple. And some of the problems we'll talk about as far as the integumentary systems are things like soft tissue injuries like cuts, lacerations, and burns, which are always horrible injuries. The endocrine system is pretty interesting. The endocrine system control the activity of the human body, but instead of using electrical impulses like the nervous system, it does it through the action of hormones, which works slowly over time. I'm not going to talk about every single gland in the body, but endocrine disorders are kind of interesting. For example, anybody know who this guy is? You young kids. Leslie, really? You don't know who this is? Anybody? Am I that old? I guess I am. Yes, Giovanni, thank you. Andre the Giant, famous wrestler from the 70s, 80s, even the early 90s. He was a phenomenal attraction. I think at his highest, he was 7'4" and well over close to 500 pounds. And what caused this ginormous stature of his is he had a condition called acromegaly. His pituitary gland, which is otherwise known as the master gland, released too much growth hormone through his youth and through his adult years. And so he shot up in height well into his early years. I think he was over 6'5" when he was 11 years old. And finally, when his skeleton stopped growing vertically, his body kept releasing that growth hormone, resulting in the wide girth of his face, the wide girth of his trunk. I mean, and this is what made him, yep, he was in The Princess Bride, absolutely, a great movie. And, he was a main attraction in wrestling for decades. But unfortunately, the thing that made him famous and popular is also the same thing that killed him. One of the unfortunate side effects of acromegaly is that the heart tends to enlarge as well, and so he ultimately died of heart failure at 47 years old. Pretty sad. From what I understand, he was supposedly one of the nicest guys in the world, but even though at the end of his career he played the villain in wrestling. I doubt anybody's going to know who this is. If you do, I'm going to have a drink. Can anybody tell me who this is? I didn't think so. This is every student looking at their final grade? No, just kidding. There's a comedic actor named Marty Feldman. He was pretty popular in the 60s and the 70s. If anybody is ever, hanging around an old fart like me and watches some Mel Brooks movies, Young Frankenstein, for example, Blazing Saddles, these are just the funniest movies that you would never see out these days, but trust me, they are funny as hell. But you see his big, giant eyes popping out of his skull. he had a condition called Graves' disease, which is an overactive thyroid, and he used that to his advantage because that was basically his shtick in his films, his big googly eyes popping out like that. He died about 10, 15 years ago. But trust me, if you want to just turn off your brain for a couple of hours, try to beam in one of these movies like Blazing Saddles, The History of the World, and Young Frankenstein is one of my favorites. Spaceballs. He wasn't in Spaceballs. Now look at this. Look at this next picture. Same kid. The parents were not feeding him too many marshmallows and s'mores. He has a condition called Cushing's disease, where his adrenal glands are putting out way too much of something called adrenocorticotropic hormone, which, among other things, causes you to retain water, pack on extra fat, expands the expands the stretching area of your bodies, and really puts a workload on the heart. And so he's not an obese child. He's a child with an endocrine abnormality. If they can correct this disorder of Cushing's disease, he ultimately will probably look like this once again. Let's skip over a little bit. All right, so where am I here? Any questions so far? Let's review this just a little bit. What organs are part of the central nervous system? Anybody give me an answer? Either out loud or in writing? The brain, and correct answer would be the brain and spinal cord. The thorax is another name for the what? That would be rib cage, rib cage. What holds the bones of a joint in place? I don't think I covered this. Giovanni, that's absolutely right. Ligaments hold the bones in place. Tendons connect muscles to bones. Ligaments attach bones to bones. What refers to the circulation of blood through an organ or a structure? Well, there's more of a medical name for it. Nope. Any of my EMT students has this word drilled into their head. They say it in their sleep. It's called perfusion. Perfusion. I want you to remember that word. It refers to the circulation of blood through an organ or a structure. Which blood vessels carry blood back to the heart? Veins is correct. Food or liquid can enter the trachea by mistake when what fails to close? I don't think I mentioned this. Little structure over the trachea, over the windpipe, that closes when you swallow. It's called the epiglottis. Epiglottis. The glottis is the opening to the windpipe. The epiglottis is a flap of tissue that closes over that tube so you don't choke. What three body systems include the most important and sensitive organs? Can anybody answer that? Okay, the answer would be the respiratory system, the circulatory system, and the nervous system. I believe the nervous system comes first. The brain will sacrifice all of the parts of the body to save itself. The respiratory and the circulatory system work really to save the nervous system, but they're all three are the most important. Any compromise to any one of them can mean immediate death or disability. Smallest bronchi end in thousands of tiny pouches called alveoli. Alveoli, very good. Any questions? If not, let's just take a 10-minute bathroom break, and then we're going to talk a little bit about what to do in the event of an emergency, how to proceed, what to do first, what to do second, how to get some information, step-by-step methodical approach. All right, guys, we'll start up again in 10. Hey, we'll start up again in just a couple of minutes. Okay, so a little story about my days as a medic in the Bronx. It's a very warm spring afternoon, around 3 o'clock, and we get a call. The call type was for a pedestrian struck. I don't know if anybody's familiar with the Bronx, but this was over in the Fordham area, right around Fordham Avenue and 3rd, Fordham Boulevard and 3rd Avenue. I don't know if it's there anymore, but there's a big Sears shopping center in that area. So we drove to that area and we heard on the radio that a police officer called it in, and it was a little 6-year-old girl who got run over in the parking lot. Okay, didn't think too much about it. As we came to the scene, there was a huge crowd. There was a couple of screaming adults, one police officer on the scene trying to control the whole situation. And as we got through, we saw this little 6-year-old girl lying on the floor, screaming in pain, with about half of her leg pretty much torn off. Bone was sticking out. It was only being held on by a little piece of skin and muscle. Big puddle of blood under her leg as well. Pretty. Just think about coming upon something like that and thinking about how you would handle it. But we handled it. We bandaged up the leg, splinted it. We got her over to Jacoby Hospital, it's a trauma center. I was so convinced that she was going to wind up losing her leg, but by the grace of God, they were able to save it. The police officer who's on the scene, some other police officers came to handle the situation, and he rode with us to the hospital. And once we handed off the patient their paperwork, this police officer was very distraught. He was upset. He felt like he froze. He felt like he couldn't do anything for that child. He was really down on himself. He forgot the fact that basically he responded to the emergency. He called for the resources necessary. He kept the crowd at bay. He kept the driver and the parents from going at each other. What had happened was somebody left their little toddler in the back seat with the car running, not restrained, went back to get her packages, and trust me, this can happen. The little toddler popped into the front seat, was able to reach the gas pedal and pull the car into reverse and slammed into that little girl just as she was walking up front. So yeah. But so anyway, that being said, the officer was pretty down on himself, but he did everything that he was supposed to do as a police officer, and he did a stellar job as far as I'm concerned. It wasn't really his job to know how to handle that bleeding leg, that screaming child, but that is the job of the medical professional like EMS or somebody else whose job is to provide first aid. And there's a lot of barriers and factors to overcome and not to be distracted by. The first thing I said is the fact that she was pretty much screaming bloody murder. Do you think that's a good thing or a bad thing? Trick question, not a trick question. Just yes or no. Good thing or bad thing is that she was screaming and crying. You guys are thinking about it. All right, Ariel, I'm gonna put you on the spot. Why do you say good?
Can you hear me?
Yep.
So I'm saying good because you have more of like a reaction from the person, so you know she's not unconscious, so she's very cautious of what's around her.
Okay, excellent answer. Yeah, the fact that she's screaming bloody murder, what do I know? I know she's alive. I know that she's alert. I know that she has an open airway. I know she's breathing. And I know she has enough blood in her body at the moment to be able to do all these things. So right then and there, that's a deep breath. So the most life-threatening things to deal with were already addressed. So then we have to worry about that leg, which we'll talk about later on, which wasn't really that hard to deal with if you can deal with the sight of blood. So let's take a look at this picture here. All right, you have somebody on. What happened? Well, maybe we don't know what happened, but you just see this person lying on the street. What would you do? Would you turn her over? Would you move her onto the side? Would you perform CPR? Would you go for the wallet? Call 911? Let's assume that the cell phone didn't have any service and you had to go a distance to call 911. Oh, look, that's a rhetorical question, really, because I don't search for a pulse. All right, that's a good answer. Good start. Looks like that's what he's doing. So basically, what we're talking about is doing a victim assessment, or what in EMS land we will call a patient assessment, a step-by-step methodical approach to each and every patient. Looking at this patient, first of all, I want to make sure the scene is safe, don't I? I want to make sure there's no traffic coming at me. I want to make sure there's no wild animals in the woods. I want to make sure this was a crime scene of a violent assault. You know, these days, more importantly than any, you want to have personal protective equipment. You know, something to cover your face, something maybe to cover your hands if she's bleeding. I don't see if she's bleeding, but you can't get the whole story from a two-dimensional photo. You want to try to find out what happened. You know, was she involved in it? Was she hit by the car? Or was she walking along the side of the road and just passed out? Who knows? What kind of resources do we need? Do we need EMS? Do we need EMS and police? Is a situation where she's entangled in a car? We need EMS, police, and fire to get her out of the car. These are the things that we have to address. Okay, and so when you're talking about a victim who needs first aid, you can categorize victims into 2 to 4 subdivisions. So anybody with an emergency, a medical emergency, is going to fall into 1 or 2 categories. Either somebody with an injury or somebody with an illness. So it's either what we call in medicine, either trauma or medical. And then the way you approach that person depends on a couple of factors. If it's an injured victim, are they unresponsive or are they responsive? And if they're responsive, do they have what's called a significant mechanism of injury, such as fall from a significant height, struck by a motor vehicle at a decent speed, any penetrating objects to the torso or head, just to name a few. I'm not going to hold you to all that. Or non-significant, a turned ankle, a bump on the head, a twisted wrist. Or you're going to talk about your sick patients. These sick patients, basically, are they unresponsive or responsive? If they're unresponsive, you're really just going to depend on what you find when you do a physical exam on them. You're going to look for signs and symptoms. Well, you can't really get symptoms from an unresponsive patient. Does anybody know what the difference between a sign and a symptom is? Okay, so a sign is something that you would either see, hear, feel, smell on a patient. Not taste, don't taste anything on a victim, but you could see their skin color if they're going pale, they're turning blue. You can hear if their airway's obstructed and they're choking or they're wheezing from asthma. You can feel the temperature of their skin. Are they burning up from a fever, or are they cold and clammy, possibly indicating shock? You can even smell things. If a person has a really pungent breath odor, that might be an indication of a diabetic emergency. A symptom is more of what the victim tells you. If they tell you they have chest pain, for example, I mean, you can't see a person's pain. You can't feel their pain. I mean, metaphorically you can, but you can't assess pain. You have to pretty much take their word for it and get a history about it. Whereas a responsive person, you would go more with that history and more with that symptom, and you would probably ask them more questions pertaining to that symptom. So again, going back to our emergency, going back to the young lady that we found on the road. Okay, the steps in assessment are first doing a scene size up. That's really more for you than anybody else. A primary check. That's to address any immediate life-threatening conditions, basically conditions affecting either airway, breathing, or circulation. Secondary check, looking for more subtle injuries after the primary that aren't necessarily life-threatening at this time, but could cause complications afterwards, or it might have been missed. We'll talk about what a sample history is in a moment. That's getting some information about that patient that may be related to EMS or to the doctors at the hospital if necessary. And then reassessment. Just because a victim is responsive and stable now doesn't necessarily mean they will be 5 minutes from now. So it's always important to what's called reassess. So the scene size up is important for you. It's important to keep you safe, looking for hazards, like I said, such as trap or animals or plague of zombies for whatever reason. Notice the potential for violence. Don't be a hero. Some of the most dangerous calls that police officers go on are for domestic violence, because the tide of behavior can change in an instant. Be observant for weapons. Reduce your exposure to potentially dangerous body substances. So, I mean, that is a real consideration these days. If you don't have personal protective equipment, you may not want to get too close. If there's any possibility of exposure to body fluids, you may want to make sure you have hand protection, eye protection. If not, maybe you can improvise. And then determine whether the problem is an injury or illness. Well, the mechanism of injury, meaning the forces that promoted this injury. Was it a blunt trauma, like somebody struck by a car? Was it a penetrating trauma, like somebody that was shot or stabbed? Or the nature of the illness? Is it cardiac, respiratory, diabetic, which we'll spend time talking about the differences later on. After that's done, then you can actually make contact with that victim and do what's called a primary check, identifying life-threatening conditions so you can immediately take action to pretty much save their life. And if anybody's taken a CPR class in the past, you notice one of the first things you do is check for responsiveness. It could be something as simple like, "Hi, how you doing? My name is Steve." "Hi, how are you? What happened?" "I fell down and twisted my ankle." Well, then you know they're pretty much responsive. You don't have to really take it any further than that. And if they're speaking to you, then you know that their airway is open. So that little girl screaming was a good sign that her airway was open. You know that they're breathing, and you know that their blood is moving to perfuse their brain. So that's always a good sign. But what about in a condition where your patient is unresponsive, where they're not making any signs of life? Well, you want to know if their airway's open. Most common cause of a blocked airway in an unresponsive patient is their tongue. You want to assess their breathing, but most importantly, you want to assess their circulation and see if CPR is needed or not. So regardless of what you see in the movies, the best way to check for responsiveness is not to slap somebody in the face, not to shake them up and down by the shoulders, but just simply to tap them on the shoulder with hands and say, "Are you okay?" and listen to their response. Now, we gauge their response by something called an AVPU scale. You probably want to know a little bit about this. AVPU, it's a mnemonic. A stands for alert. If they're talking to you saying, "Yes, I'm okay, I just tripped," or "No, I'm not okay, my chest hurts," they're alert. V stands for verbal. If you're talking to them, say, "Hi, my name's Steve, I'm here to help you, what's going on?" And they're just like, "What? Who are you? What happened?" They're really they're responsive but incoherent, confused. You would say that they're verbal. P stands for responsive to painful stimuli. So they don't appear to be doing anything, but if you pinch them on the arm or if you try to help them up, they kind of pull away, but don't really verbally acknowledge you at all. That's considered painful responsive. And then U stands for what it sounds like, unresponsive. You're not getting any reaction from them whatsoever. So for an unresponsive victim, the first thing you want to do is activate the emergency medical services immediately. And then you want to assess their airway. Do they have an open passage from the atmosphere through the trachea to the lungs? Are they getting that air in? And like I said, the most common cause of a blocked airway in the unresponsive victim is their own tongue falling in the back of the throat. So a very simple way to fix that is to do what's called a head tilt chin lift, putting one hand on the head, two fingers on the chin, and pulling the head back as long as you don't suspect there's any spinal injury. But even if you do, it's more better. It's more better. Did I say more better? It's better to open the airway because that will kill him. Manipulating the neck may paralyze him, but closed airway will kill him. So what do you think is the bigger priority here? And you want to know if they're breathing. How do you assess for breathing? Well, look at the chest. Is it moving up and down? Do you hear breath noises? Do you hear? Can you feel air on your cheek or on your hands? They're moving. I mean, again, these are textbook criteria that were written before this whole issue of COVID. So just take it with a grain of salt. You may have to modify your technique a little bit, but again, that remains to be seen. Let's talk about circulation, checking to see if the heart is beating or not. Well, in general, it's usually not recommended for lay rescuers. Most community CPR classes don't teach pulse checks because they're difficult. They really are, even for experienced healthcare providers. I've been in the ER assisting with cardiac arrest, and even the attending in charge will tell everybody to stop doing CPR while he's trying to assess a pulse, and trying to assess a pulse, and trying to assess a pulse. And meanwhile, the person's not moving. They're not getting any air or oxygen to their brain, but this person thinks he feels a pulse. I think I feel a pulse. The monitor showing flatline, but I think I feel a pulse. I think just hold on, don't do any CPR. I don't want to do CPR if there's a pulse. And he thinks he feels a pulse is because he's probably not worked up a cardiac arrest and he's feeling the own pulse in his own fingertips from his adrenaline pumping. So we can check for pulse. The proper way to check for a pulse in the adult is taking two fingers and putting it to the side of the neck between the Adam's apple and the sternocleidomastoid muscle and gently pressing to feel a pulsation for no more than 10 seconds. If you absolutely positively feel a pulse, you don't have to do CPR. If person says, "Hey, get your fingers off of my neck," well, now you know you don't have to do CPR. However, if there is a doubt, if you, within that 10 seconds, you're just not sure that you can feel a pulse or not, and there are no obvious signs of life, give CPR. And we'll talk more about that next time. But it's better to, it used to be when I learned CPR, oh God, if you do CPR on somebody on a pulse, you're going to kill them. Okay, well, no, that's not going to happen. Again, if you pressing on their chest and they go, ow, ow, stop it, and you continue doing CPR, then the Good Samaritan laws may not protect you. So let's say that they are unresponsive but do have a pulse. Most victims shouldn't be moved. They should be left in their location, with some exceptions. If it's an unsafe location, so that lady was in the middle of the road with lots of high-speed traffic going around, that's not a really safe location. Victim is face down and needs CPR. You can't do CPR on a person who's face down. They have to be on their back. Victim has difficulty breathing from vomit or secretions. That's how a lot of rock stars died in the 60s and 70s, choking on their own puke. You're alone and you must leave to get help. Then there's some things you can do. But in general, with an unresponsive victim with no signs of spinal injury, it's better to position in what's called the recovery of the high arm and endangered spine position. On the left side, you see how one leg is bent, one arm is bent and tucked under the face, and one arm is bent and stretched out to prevent rolling over. Leaving them on their side does a few things. Still maintains the spine, but it also allows for any excessive saliva, blood, or vomit to drain from the mouth and not go in the lungs, causing what's called an aspiration pneumonia. It also keeps the airway open because it prevents the head from crunching forward and having the tongue move in the back of the throat. So that's just something to think about. So after addressing the airway, breathing, circulation, and by the way, ABC does not necessarily have to be done in that order. If you see somebody down on the ground and you see blood pumping from an artery, like an arterial bleed, they're going to bleed out in seconds, if not a minute. So are you going to really waste time tapping their shoulder? Are you okay? Are you okay? No, you're going to immediately try to stop that bleeding, because by the time you finish your assessment for the mental status, they're going to bleed out and die. So it doesn't have to be done in necessarily that linear order. So let's go for the secondary check. You want to ask them, you want to assess for things like neurologic injury. Can they wiggle their fingers, wiggle their toes? For unresponsive victims, just erase that from your memory. We do not do a Babinski test. That's incorrect information. Babinski test is something that looks for something completely different. But if you have something like a pen or some blunt object, you can take the shoe off and you rub that pen on the sole of the feet, and if there's any response, that's good to know. It means there's some neurologic activity to those lower extremities. What's even better is if you run that pen on, or whatever you got on the sole of the foot, it responds, and then 10 minutes later it doesn't. And that's important information. That means this person's getting worse. Whatever's happening is now compressing that nerve, and they're trending in a bad place. We talked about the difference between signs and symptoms. A sign is something you can see, feel, hear, smell. A symptom is things the victim feels, things the victims can describe, their chief complaint. So doing a physical exam for injury, very simple mnemonic to help you remember is DOTS, dots. Gets a little more complicated if you take an EMT class, but D stands for deformity. What you got here is a dislocated elbow. O stands for open wounds, lacerations, avulsions, tendons. This looks like an open wound that occurred on somebody's tooth. Tenderness, when you press on something and go, ow, quit it, ow, quit it. And then swelling. As you can see here, this ankle is prominently more swollen than the other one due to inflammation. Another thing you want to try to take notice of is somebody's skin color, temperature, moisture. Can give you a big idea if they are perfusing or not. Color, what's a normal skin color? Well, that's kind of an unfair question, because if you look at 7 different people, you'll have 7 different normal skin colors. Depending on your ethnic background, depending on your family history. But if you look in the lips, the tongue, pull the eyes down and look at the skin of the eye called the conjunctiva, no matter what your ethnic background, what your skin color is, that should be pink in everybody. Pink mucous membranes are a sign of adequate perfusion. If you look at those areas and they seem very pale and white, that's a good indication that they are not perfusing properly. If they are sweating like crazy in a room that's really room temperature, no reason to be, that's a sign that that sympathetic nervous system might really be clamping down and working in overdrive. Could be from heart attack, could be from diabetic emergency. Remember, that fight or flight system kicks in whether it's a homicidal maniac coming after you or if there's a life-threatening thing going on in your heart. Doesn't differentiate the two. If you're talking about an injury, sometimes it's appropriate, sometimes it's not appropriate to expose the injury. Obviously, with the individual's consent, permission, explain what you're doing. If it's in a situation where you can't, maintain their privacy, maybe you want to hold off until EMS gets there. I have just no patience when I'm working in the emergency room when I have an EMS crew telling me a patient's got a dislocated knee and their pants are completely covering their knee. Like, what are you basing this on? Other things that are very important to look out for. If you have an unresponsive patient, very difficult to get information from them, but if you look for medical alert tags, that can give you a lot of information. It can tell you if they're diabetic, it can tell you if they have seizures, it can tell you if they have any major drug allergies, and that's if they can't tell you themselves. That's the whole purpose of these tags. Another mnemonic to learn is something called sample, getting a sample history. It's a good idea to try to get as much history on the victim, especially if they really do need to go to the hospital, because at some point, if they pass out or become unresponsive before the next caregiver arrives, they never get that information. So you getting that information and then passing it off, even if that's the only thing you do, that's still good first aid. So signs and symptoms, what's wrong, what hurts, usually known as the chief complaint. If they're having something like chest pain, are they having any other symptoms like nausea or dizziness? A stands for allergies. Are you allergic to anything like penicillin or sulfur or even aspirin? Do you have a bad reaction when you take any of these medications? That's important for the ER. If they don't have that information, they don't know not to give it. Are you taking any medications? And not just prescription, but over-the-counter medications can be very dangerous as well. Even herbal and so-called natural medications. Things like St. John's wort, some other type of herbal medications can interact with other traditional medications, so it's kind of important to know. And past medical history, anything major like diabetes, asthma, high blood pressure, cancer, surgeries, anything like that. A thrombosed hemorrhoid, is that really an important piece of information? Probably not, unless their complaint is they're bleeding out of their rectum, then that's kind of important to know. Last oral intake, when's the last time they had anything to eat or drink? Well, that's very important because if this person's being rushed to the trauma center and they need surgery, the anesthesiologist is going to want to know if they need to do surgery right now or they need to decompress that person's stomach or what kind of risk this person is for throwing up while they're under anesthesia. And the events leading to the injury or illness, what happened? Did you walk up the stairs and miss a step and fall down? Were you up the stairs and suddenly got dizzy, lightheaded, and fell down the stairs? That means two things could have been happening. Some illness that caused the fall, and then the end results of the fall, the injury. And a basic guideline is that any serious illness or injury should be rechecked every 15 minutes. Any unresponsive or unstable victim should be checked every 5 minutes. My motto is to recheck the person as often as you can. I mean, the more the better. Okay. Any questions so far? Okay, so let's do a little review. What are some issues to be aware of during the scene size up? And I don't really have a slide with an answers. I want you guys to answer this. Think of anything. What should you be on the lookout for? Okay, check for danger, obviously, very good. What else? What about checking about what happened? What about checking the number of victims you had? If you had an overturned car and you see one person on the street and there's a hill, could there be a potential for a second victim? What about, do you have proper checking for safety? Yes. What if you have making sure you have proper personal protective equipment? What if there's a downed power line? I don't know, would you go near that? Who would need to be called? Probably the power company, right? So these are the things to evaluate during a scene size up. What three major physical signs should be evaluated during the primary check? If you could sing your alphabet song, you should know this. Breathing is one. Two more. Well, the answer is airway, breathing, circulations. Responsiveness is more a mental sign than a physical sign, but that's a good answer too. So if you see this question on a test, it's always airway, breathing, circulation. These are the big things that are checked during the primary check. You know, the things that can immediately kill the victim. Okay, an unresponsive victim with no sign of spine injury should be placed in the what position? Julie, you're not wrong, but there's another word for it. That the Haynes position is one word. There's another word for it as well. So that would not be okay, Saira, but what's it called? It's generally called the recovery position. The recovery position. But the Haynes position is also a good answer. Okay. What does that stand for? Symptoms. I put signs and symptoms, but symptoms is fine. What does A stand for? Allergies. Good. What does M stand for? Medications. What does P stand for? Oh, I got that already. Sorry. What does L stand for? Last oral intake. Excellent. And what does E stand for? Events leading up to the emergency. Very good. Any questions? Julie, can I go back to what? This is all going to get posted. It's all going to get posted, and it's all on your course. It's on your Blackboard as well anyway. So guys, with that, my apologies. I'm not going to be able to review the homework on this one, but what I'll do is I'll make a recording of a review of the answers. You can also review the answers yourself because it should give you feedback and a little mini lesson about it. Well, I'll do a recording of the homework just so you can go over it, and I'll have that posted probably by tomorrow. All right, guys, and I'll keep you updated about the next class. Julie, just email me, okay? Get more messages than I can count. All right, guys, stay safe.